Hello and welcome to The Agenda. I'm Stephen Cole. This week, we're looking back at the key stories of 2021 brought to you here on The Agenda, starting this week with, what else? The COVID-19 pandemic. The COVID-19 pandemic has once again dominated the news agenda in 2021 as countries around the world grappled with the biggest global crisis since the Second World War. Over the past year, we've covered almost every angle, from the devastating economic effects to how populations have coped with repeated lockdowns and the way vaccines have increasingly been seen as the way out of the crisis, for those with access to them at least. So-called vaccine nationalism has seen the world's richer countries buying up the vast majority of supplies, at the expense sometimes of poorer nations. Back in February, I asked Dr. Siddhartha Datta from the World Health Organization to tell me more about the progress of the COVAX initiative, which was set up to ensure the fairer distribution of vaccines. Doctor, can the WHO help in the fair distribution of vaccines?
The COVAX mechanism, as you are aware of, is one of that unprecedented effort made by WHO along with several other member states and organizations, including the European Union, which ensures this distribution or access to the vaccine to all countries, irrespective of their income level. The low-income countries, the lower middle income, the upper middle income, and the high-income countries coming together around that concept of ensuring everybody gets an access to this global public good. It's a matter that we should have that solidarity in our thoughts, in our actions, in reality, to ensure
we should have those in our thoughts and our
everybody
actions, but it's not happening. Wealthy countries are keeping the vaccines to themselves.
Yes, but we have seen that, and we are all seeing this, vaccine being rolled out in the high-income countries much faster than the other low-income and low-middle-income countries. But I think we have also seen the higher-income countries coming together, at least in the European Union, as you see, their commitment, and it's not only a commitment, but their contribution. More has to be done in this whole process, and there is no doubt into that one for sure.
The squabbling over vaccine supplies between the world's richer nations hotted up as soon as they began being approved for use. Coming soon after Brexit, it worsened relations between the UK and the UK's European neighbours. In April, I solicited the opinions of 3 experts about whether or not they thought the UK's initial vaccine drive success was the result of its newfound freedom from the European Union bloc.
From a trade point of view, you have vaccines and their ingredients as part of huge supply chains going between the UK and the EU. So you can't simplify and say that we've managed to make all our own vaccines. Clearly, there have been big supply chains. Some of our vaccines have come from the EU. It's not always entirely clear why the UK has done so well, but it is quite clear to me that the UK has done better than the EU in organising vaccines. And it is very interesting that I think the EU has responded badly to that. I think that they don't like it, but I'm not sure that either the UK or the EU quite know why that has happened in that way.
And Peter Klepper, would the cynic say if it wasn't vaccines, it would be something else post-Brexit?
Well, there's 2 things I think that distinguish the UK from the EU. First of all, the UK did not take part in the joint EU27 negotiations with big pharma companies. And secondly, the UK also, when it was still bound by EU law at the end of December, they opted for an exception procedure that would allow them to approve the Pfizer vaccine much more quickly than the EU. Now, both things, in theory, could have happened with the UK still being a member state of the EU, but I think it's fair to say that politically the pressure would have been much more strong for the UK not to do that and to follow the EU, and thereby, especially when it comes to the vaccine procurement, also ending up in the place where EU countries are today, which is they do not get enough vaccines.
And Professor Young, the EU and UK have come to blows over vaccine rollouts, but generally is Europe and Great Britain in accord on medical and scientific issues?
Yeah, I think there's still enormous amount of cooperation and engagement. Certainly, even personally, I have a lot of interaction with colleagues across Europe. I don't think any of this wrangle is getting in the way of that cooperation, but clearly there's a lot of frustration.
The very rapid COVID-19 inoculation drive earlier in the year threw up a whole host of questions about vaccine safety and efficacy around the world. In February, we asked our viewers to put their questions about the vaccines straight to the experts in a special edition of Ask the Agenda. A question now from Mo Yazdiar, who tweeted us with the question, can vaccinated people still spread COVID? And I suppose he wants to know if they still have to wear masks and so on once they've been vaccinated.
Vaccination is very important. Until we reach a high enough level of herd protection, we're going to need to keep the masks on. We're going to need to continue to use distancing, and we're going to need to continue to avoid crowds. At some point, maybe this year in the higher income countries, we will be at that level where governments can start to loosen some of the restrictions that were put on individuals. But until that time, we really do need to protect ourselves using a mask, and also very importantly to protect others. You know, almost all of the vaccines, so 7 out of the 8 vaccines that have shown efficacy so far, that is protection, were really designed to look at, does the vaccine protect against disease? The vaccines in general have not been tested to show that they protect against infection or transmission. And taking off your mask means that if you get infected, you probably aren't going to progress to COVID disease or severe disease, thankfully. But you could still transmit the virus to others.
Hi, I'm Kai Miller in Singapore, and my question is, a lot of people may not want the vaccine. Will that be an issue for the rest of us?
Definitely, the more people who accept vaccination, the sooner we will all be protected. So I think, you know, and WHO has some very interesting guidance on this. First, lead with the science. Second, make vaccines easy to get, and don't complicate the systems for saying, okay, you know, those people who are 64 years and 9 months or older, no, you have to make it simple, make it accessible, make it enable people, make it easy for people to get the vaccine. The second part is provide positive socialization around the vaccine. You know, we're doing this together. We are going to beat this if we do this together, if we cooperate, if we all get vaccinated, as many people vaccinated as possible, continue to use your mask. We need to create a positive social vibe around this. You know, in Indonesia, they're vaccinating influencers because they want people to know that these vaccines are important, they're safe, they're efficacious. And if we want to go back to going to the pub or visiting our parents in nursing homes, we're going to need to have protection against COVID-19. And the final thing is motivation. How do we get people who are just, you know, at home and they don't know and you know, they may not want to sign up online? How do we get them out of their chairs? Well, governments need to figure out ways to communicate and motivate people, because really this is something that really is going to require all of us, our participation and our engagement in committing ourselves to ending this pandemic.
Of course, away from the pressure on healthcare systems around the world, the COVID-19 pandemic has caused the deepest ever peacetime economic crisis. Global economies may now be starting something like a recovery, but for some industries, the lingering effects will be felt for years, perhaps even decades to come. The aviation sector was devastated as global travel almost came to a halt. In July, Willie Walsh, former CEO of British Airways and now head of the industry body IATA, outlined to me the true scale of the impact.
In the first place, I think we have to focus on the survival of the industry. We are in survival mode. As you've said, this is the deepest crisis the industry has ever faced. And maybe to put it into context, because people often ask me to compare what we're seeing today versus previous crises. If I look back to 2001 and following the tragic events of 9/11, the airline industry's revenues fell by about 6.4%. very, very significant. We haven't seen anything like that before. Move on then to 2009, the depth of the global financial crisis. Industry revenues fell by 16.5%, a really deep crisis for the industry. Last year, 2020, revenues fell by 56%. So this is on a completely different scale to anything we had seen before. And therefore, you would expect every airline CEO and management team around the world absolutely focused on surviving this deep and quite an extended crisis. Moving out of this, our number one priority will be on the environmental performance and ensuring that we not only have a sustainable business from a financial point of view, but a sustainable business from an environmental point of view. So that will become the key focus of IATA and the industry as we come through this crisis.
And how is IATA's relationship with governments now? Because there have been quite a few hiccups, haven't there, particularly regarding travel restrictions?
Yes, I would be very critical of a lot of governments because, in fact, the crisis we face now as an airline industry is not really a crisis as a result of the pandemic. That bit was during the early phases. What we're facing now is a crisis because governments continue to apply restrictions on people being able to travel, particularly travel internationally. And our argument is very simple. The risk environment we're operating in today is completely different to what we faced 15 months ago. 15 months ago, we were dealing with an unknown. 15 months ago, there was a genuine fear that health systems would be overrun, that hospitals would not be able to cope with the number of people contracting the virus. That's not the case today. Virus transmission levels have largely reduced in many countries. And even where we are seeing a spike, it's not leading to increase in hospitalization or increase in intensive care. So the health crisis, I think, has largely been overcome. Yet the restrictions that governments put in place remain in place today, while the risk environment has significantly reduced. So we would be very strong in encouraging governments to reevaluate the measures that they have in place today. And I'm pleased to say we are seeing governments do that. Recently, a lot of governments have come out and said people who are fully vaccinated will be able to travel without restriction and without testing. And that's something I think that is genuinely welcomed by everybody. What we want is a sensible testing regime for people who aren't vaccinated, because we can't have a world where only those who are vaccinated are able to travel. There are many people who haven't had access to vaccines, many who are unable to take the vaccine. So we have to have systems in place that will enable those people to travel as well.
Still to come here on this agenda special Year in Review, a COVID Olympics. We'll look back at the spectator-free Tokyo Games. Mari, what would you say is a good question?
Stephen, I'd say it's one where there's always more than one answer.
The Answers Project is a new podcast series from CGTN Europe. With me, Stephen Cole.
And me, Mari Beveridge. In each episode, we'll take a complex question.
And with the help of some of the world's foremost experts, shine light on some of the answers. So join us for The Answers Project.
Available wherever you get your podcasts.
The world's currencies are more connected than ever before. The mechanisms that drive the economy are universal. Money moves markets. We explain these trends and show you how the cash in your pocket can have a wide-reaching effect. Because money makes the world go round. Global business.
Welcome back to the Agenda Year in Review. The coronavirus pandemic and the rolling lockdowns imposed around the world often came with orders from national governments to stay away from our offices and work from home instead. And many of those who were able to do just that say they'd been more productive and enjoyed a better work-life balance. In March, Dr. Hee-Jong Chung, who's carried out research into the subject, told me the global health crisis just might have changed the way we work forever.
A lot of the hesitations managers had prior to the pandemic about whether or not workers can work efficiently at home, a lot of their hesitations have disappeared largely due to the fact that despite it being the pandemic, workers have been showing huge levels of productivity and efficiency during this period working from home, where actually they were able to carry out work even better than they were doing in the office in the midst of the pandemic. It has also changed the preferences of workers as well. Many workers found that they actually really enjoy working from home. And especially because there wasn't much of a stigma around working from home during this period, they would like to work from home in the longer future as well. So we expect that there will be, possibly not for all companies and not for all workers, but for many, real shift in the way we work from home or where we work, with many being able to work from home on a much more regular basis.
David Malpass at the World Bank said, and to me rather surprisingly, people are working too hard when they're working from home. Do your findings support that?
So even before the pandemic, what we see is that despite the popular belief that working from home is someone just kind of in their pajamas all day watching daytime TV, actually, people who work from home work longer hours, they work harder as well. And there's two reasons to that. One may be because, for many of us, commuting times take up to about 1 or 2 hours, even maybe up to 3 hours a day, some of which people give back to their employers by carrying out work during that time. Another thing is that, as I said, there's still a bit of a stigma, even internalized stigma about working from home. So when you are not really doing a lot of work from home, you feel like, ooh, am I slacking off? And it's more evident than, for example, if you were to do the same thing in the office. So for example, checking Facebook in the office, people wouldn't think much of it. But if you do it at home, it really feels like you're slacking off.
Is there also, if it suits some professions more than others, is there also a sexual divide? Does working from home suit men more than women or women more than men?
Well, prior to the pandemic, we've seen that it was men that were gaining the access to working from home more than women. And this is largely due to the fact that, again, the assumptions behind workers and their capacity to work from home, because our societies are still kind of under this male breadwinner and female caregiver ideas. Employers thought that women, when they work from home, they don't really work from home, that they'll prioritize housework and childcare. That isn't necessarily the case, but that prohibited a lot of women from being able to work from home. During the pandemic, we've actually seen that there were more women working from home than men, again, because employers didn't have much of an option but to allow certain women work from home. And to be honest, providing women or any workers with care responsibility, the capacity to control when and where they work, can be incredibly beneficial for allowing them to take part in the labor market and take part in the labor market in a much more longer hours basis. And again, to, for example, address gender equality issue. Whether the pandemic has changed the views of managers going forward is something that we'll have to see.
That was Dr. Hee-Jung Chung talking to me about the future of work back in March. Of course, the social impact of the COVID-19 crisis will be felt for a very long time, perhaps nowhere more so than the fight for gender equality. Indeed, as many women were forced to leave work to care for family during the pandemic, one report from the World Economic Forum and UN Development Programme suggested COVID may have set gender parity back by an entire generation. I asked two equality campaigners, Rachel Verdin from the University of Sussex and Wanda Wypowska, then Executive Director of the UK's Equality Trust, just why that was.
I think it's important to first think about what the pandemic has done, and that is to really kind of pull back the veneer on the inequalities that are already bubbling away. You mentioned there the gender pay gap, which is very much still rife, and we know that women still take on by far the majority of caring and domestic responsibilities in the home. And what COVID has done is really kind of amplify those challenges and brought them to the fore. But I do think it's perhaps a little simplistic to talk kind of in generational terms. I think there's a bit more nuance needed. If you think about sort of 30, 40 years ago, the Equal Value Amendment was just being passed. Women's engagement in the workplace and in political life and levels of educational qualification have really ramped up since then. And there's been a whole raft of legislation that's been passed. And I don't kind of see a mass exodus of women or perhaps, legislation being repealed. But I do think that risk is perhaps more likely in terms of those games perhaps being undermined. We've seen during COVID a real lack of focus on women and women's needs in policy planning. And I think, the risk of those gains and equality gains being disregarded and not prioritised is really what I think is, perhaps more of a risk at the moment.
And Vanda, you've been working on the fight for equal pay for some time. Would you agree with Rachel on that one?
Yes, absolutely. And I think what we need to look at is not just the gender pay gap, as Rachel was referring to, but the other issues in terms of childcare, in terms of the types of jobs that are being created, and the UK's government focus on a construction and infrastructure rebuilding rather than an economy of care, which would actually provide far more jobs and far more for the economy. But we also have to think about what you mentioned in the first place, which was the issue of equal pay, which is the fact that, unfortunately, we still have a lot of women who aren't being paid the same as men for work of the same value or for the same jobs. And that's something that's very much hidden, because in order to find that out, women need to know just what their male counterparts are being paid. And so that's a separate issue, but an equally valid one.
It may have been a year later than planned, thanks to the pandemic, but the Tokyo 2020 Olympics did finally take place in 2021. And they were the first games in modern history to be held without spectators present. Well, just before the event in July, I asked the president of World Athletics and double Olympic gold medalist Sebastian Coe what sort of effect empty stadiums would have had on the athletes.
They know that this is the biggest platform for them in sport. And also bear in mind a slightly sobering statistic, and that is that 70% of competitors at an Olympic Games only have one bite. They're not going to come back. I was lucky, I competed in 2 games, but the vast majority are not going to be coming back for a second stab at this. So they're very pleased that the authorities, whether it's the International Olympic Committee or the governments and cities involved in Japan, or in fact the Herculean work of the international federations, my own health and science teams, have probably done little else in the last year than figure out how we can get competitions back onto the calendar in a safe and secure way. So I think they recognise that a lot of work has gone on in the background. I can't think of another sporting event. Actually, I can't think of another event in the last 50 or so years that has had so much forethought devoted to it in terms of delivering something safely and securely, not just for the competitors, but for the people of the country that are hosting it.
You were being as humble as normal when you said you took part in 2 Olympics. In fact, you were a double gold medal Olympic winner. So how important was the reaction of the fans to you when you were competing?
Yes, look, I'm not going to say to you that I would have rather competed in front of an empty stadium. Of course I wouldn't. But I think these were very different circumstances, and the crowd was hugely important to me. You know, the moment, the atmosphere of walking into a stadium from the Arctic loneliness of a warm-up track, probably 3, 4, 5 minutes away, and suddenly looking up, into the rafters and with 100,000 people there, it's obviously going to be a very different experience for the athletes in Tokyo. But I do think that they have shown an extraordinary resilience to the circumstances that they found themselves in. And look, it's an interesting and it's a larger topic, but at the very beginning of the lockdown, the pandemic, everybody was saying to me, oh, look, the athletes, it's going to be really hard, which it was, and they're going to have to work remotely, and it's going to be... Actually, in individual sports, most athletes work remotely most of the time, and interestingly, they utilize a lot of the technology was far more familiar to them before we all went into lockdown than it probably was to us. You know, often their coaches are not based in their own countries, 8-9 time zones away. So it's that type of technology that allows them shortly after a race or a performance to be able to sit down, share the technicality of maybe what they've done with a coach. A training session can be scheduled at that moment for the following day on what you've just witnessed in a competitive environment. So actually the athletes are very well prepared for this. It's not what they would choose, but they are very much better prepared than large swathes of the global populace.
Of course, it wasn't just the Olympics in the sporting world affected by the pandemic. Many leagues and competitions around the world in a myriad of sports were suspended when COVID-19 first hit. In 2021, many managed to get back up and running, firstly behind closed doors, and then slowly, thanks largely to the vaccine rollout, supporters in many countries were let back in to watch their favourite sports. But as Stephen Zhang, president of Italian football giant Inter Milan, told me just ahead of the European Football Championships in June, the pandemic has still had a devastating and possibly permanent impact on the beautiful game.
Unfortunately, COVID and the whole pandemic situation really changed the landscape of football, really impact a lot of industry who are related to offline services, offline experience, the consumers, the consumptions which is related to physical or in-person experience. So football or sports industry is one of the industry or fall into that category. So without the fans in the stadium, without experiencing, seeing the game in person, or closing a lot of stores, restaurants, eventually damaged a lot to our industry. If you look at only 1920 season alone, the overall European football industry lost 2 billion or 3 billion euros. So if you combine that with 2 seasons, that's double, which is around 5 or 6 billions overall in terms of damage for many, many clubs or people who are related to the football industry. So obviously that's going to be something not going to be recovered anytime soon. So for us, for the competition, the quality is definitely not going to be as the same before COVID. And all the clubs today, we have to think about how to cutting the costs, how to going to be still sustainable in the next couple of years when we're recovering from COVID. At the same time, how to engage with the fans, with the audiences who were losing in the past couple of years. So how to making sure utilizing the digital platforms, utilizing the social medias, utilizing the fans who are not able to travel, who are not able to see the players, the games in the stadium. That's the key topic or key conversations that we're having. But of course, at the same time, there are some things were built up even before COVID, which in terms of cost structure, in terms of a sustainability of the football club. So eventually it forced us, even after COVID, to introducing new products, new changes into our system, and then testing the water to see what our consumers or fans would like to see.
Stephen Zhang from Inter Milan, thank you so much for joining us on The Agenda.
Thank you very much. Thank you.
Don't forget you can watch everything from past Agenda episodes and find additional exclusive content on our website, cgtn.com/Europe, or on our YouTube channel. And of course, you can follow us on Twitter, Facebook, Instagram, @CGTN Europe. Coming up on a future Agenda, from a presidential election in France to the Beijing Winter Olympics, we'll be finding out just what to expect in 2022. But for now, from me, Stephen Cole, and all the Agenda team here in London, it's goodbye.